Okay. Today we are going to discuss about the uh, uh, disease of the pulp. What are the diseases can result in the pulpal infection, pulpal inflammation? Okay. So the first we are going to discuss about pulp. The dental pulp is the part in the center of the tooth made up of living connective tissue and odontoblast. Okay. So basically, the pulp is surrounded by the dentin. It is inside the. It is surrounded by the dentin. Okay. So it is also that. The pulp which contains the blood vessels, nerves, and the connective tissue. So when we talk about the pulp is surrounded by the dentin, which is contains connective tissue, which contains blood vessels, nerves, and blood vessels and blood vessel nerves and lymphatics. Okay, so pulpitis means the inflammation of the pulp. So we are going to discuss about the causes of the pulpal disease. According to Grossman, it is broadly divided into physical, chemical, and bacterial. So the physical are the mechanical, thermal, and electrical. Okay, so according to the Grossman, in the physical, it is divided into mechanical, thermal, and electrical. In the mechanical, trauma, then comes pathological where crack throughout the body of the tooth and barometric changes. Okay, so mechanical physical injury to the pulp is trauma, accident, road traffic accident, and iatrogenic pulpal exposure during the cavity preparation. All these are the cause of the pulpal disease. Pathological wire means improper brushing technique. All that things will result in the pathological wire or the bruxism. Or it's also all these things will result in the attrition of the wire of the tooth and a crack through the body of the tooth and barometric changes. Change in the atmospheric pressure can cause pain to the tooth. These are the mechanical factors that result in the cause of disease of the pulp. Then comes the thermal. Thermal means that is thermal factors that causes the injury to the pulp. One is heat during the cavity operation. That is exothermic heat during the setting of the cement. Conduction of the heat and cold through the deep restoration without protective base, and a frictional heat during the polishing of the restoration. So thermal, so because of the heat during the cavity preparation. Normally the aerator RPM is 1.52 lakh. So this rotation will produce a heat. So to cool down the heat, there is a air water spray on the aerator. So during the cavity preparation, you should be very careful that the air water spray should be worked properly. Otherwise, it can produce heat and cause injury to the pulp. Then exothermic, especially in zinc phosphate cement, it's during the setting, it is highly exothermic. It is exothermic. It releases the heat. So this heat can cause injury to the pulp. Then comes the conduction. And secondly, when amalgam is given without base, it can cause injury to the pulp. It can cause inflammation because of the hot and cold food will result in inflammation of the pulp or result in the hyperemic pulp or frictional heat during the polishing of the restoration. Especially when we do a restorative polishing of the restoration, especially composite and amalgam, heat can be produced during the rotation of the disc. So all these things will result in the thermal injury. And electrical is a galvanic corrosion. When two dissimilar metals comes in contact with in the oral cavity, the saliva will act as an electrode and the electricity is produced, which can cause pain to the patient, that is galvanic shock. These are the physical that can cause the injury to the pulp. Then comes the mechanical, the phosphoric acid, acrylic monomer, and erosion. So phosphoric acid, especially when we do etching of the enamel for the composite restoration, and acrylic monomer in the cold cure. So this can cause, it can passes through the tendinal tubules and cause injury to the pulp. And erosion. Erosion is mainly when we patient continuously having acidic beverages can cause erosion of the enamel. Then bacteria, that is toxin associated with the caries, direct innervation of the pulp from the caries of the trauma or anachorosis. So bacterial toxin associated with the toxic metabolic byproduct from the caries, direct inversion of the pulp, direct innervation of the from the caries of the trauma and anachorosis. Classification of the pulp disease. According to the Grossman, it is based on the pulpitis, that is inflammation, reversal and irreversible. Then comes the pulpal degeneration and the necrosis. Now, the pulpitis can be irreversible pulpitis, that is reversal pulpitis, that is symptomatic and asymptomatic. Irreversible means acute, that is abnormal response to the cold, abnormal response to the heat, and chronic is asymptomatic with the pulpal exposure, hypoplastic pulpitis, internal resorption. Then comes pulp degeneration, calcific and others, and the necrosis. These are the classification of the pulpal disease. It is broadly divided into reversible pulpitis, irreversible pulpitis, pulpal degeneration, and necrosis, pulpal necrosis. Okay. Now we are broadly we are going into the factors affecting the response of the pulp. One is severity and duration of the irritation. If the irritation is if any irritation that lasts for more than 3 months, it can be considered as a chronic. So severity, what are the different severity of the bacteria, the bacterial byproduct, and its duration. So it will differ. It will affect the it will result in the pulpitis, nature of the irritant, how it frequently it affects the pulp, and the health condition of the pulp or the pre-existing condition of the pulp, apical blood flow, locality of the pulpal chamber, and post defense. All these factors will result in will affect the response of the pulp. If the host defense, if we take an example as host defense, if the patient is having autoimmune disease or diabetic, there's a chance for the infection of the pulp. Local anatomy of the pulp chamber. If the pulp chamber is calcified, if the pulp chamber is calcified, it will result in the pulpitis. Then comes the apical blood flow. In case of trauma, if the apical blood flow is less, the response of the if the blood flow is less, there is a chance for getting the pulpal necrosis, health and condition of the pulp in the pre-existing state of the pulp, and nature of the irritation and severity. All these factors will affect the pulp status. Okay. Now comes the pathway of bacteria inversion of the pulp. How the bacteria enter into the pulp. Most common cause of the pulpal injury. So opening it through the dentinal tubules. That is due to the caries, clinical procedure, trauma-induced fracture, and a micro crack. So opening, one is the bacteria can be entered through the dentinal tubules due to the caries. Then comes the clinical procedures, trauma-induced fracture, and a micro crack. So these are the three pathways where the bacteria can be enter into the dentinal tubules or into the pulp. Bacteria from the gingival sulcus or the gingival pocket, periodontal pocket, then reinfection, extension of the periapical infection from the adjacent infected tooth. So this is the way. So main cause of entry of the bacteria into the pulp through the dendrinotubules, that by through the caries. One is to the caries, then comes the clinical procedures, then comes the induced through the fracture and microcrack. Then comes the bacteria to the periodontal pocket or gingival sulcus, endodontic reinfection, and extension of the periapical infection from the adjacent infected tooth. So these are the pathway of bacteria entering into the pulp. Anacorosis. Anacorosis is the transport of microbes through the blood or by the limbs. By the limb to an area of inflammation such as tooth with the pulpitis. So if the patient is having an infection in a remote area of the body, the bacteria can be moved through the blood vessels and can reaches the inflamed pulp. This is known as anaporosis, the transportation of microbes from through the pulp, through the bloodstream or the limbs to an area of inflammation such as pulp, such as tooth with the pulpitis. So this is known as anacorosis. So aerodontalgia. The toothache occur at a low atmospheric pressure, experienced either during the flight or during a test run in a decompressed chamber. Observed in a higher altitude over 5,000 feet. The tooth with the chronic pulpitis can be symptomless at the ground level, but may cause pain at a high altitude because of the reduced pressure. So lining the cavity with a varnish or a base of zinc phosphate cement with the subbase of zinc oxide eugenol in a deep cavities. So aerodontalgia is mainly occur as a pain caused at low atmospheric pressure, especially in a high altitude. So care should be taken. So this can be prevented by lining the cavity with a varnish or a base of zinc phosphate cement with a subbase of zinc oxide eugenol cement in the deep caries. Aerodontalgia is mainly occur when the incomplete root canal. All these things will result in the pain when the atmospheric pressure is less. Okay. Now comes irreversible pulpitis or hyperemia. Irreversible pulpitis, as the name indicates, it can be revised into the normal pulp when the irritating factor is removed. So mild to moderate inflammatory condition of the pulp caused by the noxious stimuli in which the pulp is capable of returning to the uninflamed state following the removal of the stimuli. That is irreversible pulpitis, or other name is pulpal hyperemia. What is the etiology? Etiology is trauma, thermal shock, excessive hydration of the cavity, galvanism, and bacteria from the caries. So what is irreversible pulpitis? So other name is a pulpal hyperemia. So it is a mild to moderate condition. When the stimuli is removed, the pulp can be reversible to the normal condition. So what are the etiology? One is the etiology is trauma, etiology is trauma, thermal shock, excessive dehydration of the cavity, galvanism, and bacteria from the cavities. So excessive dehydration means after the cavity operation, don't use 3-way syringe to dry the cavity. So when you dry the cavity, it can be a result in the injury to the odontoblastic process. Galvanism is when two dissimilar metals comes in the oral cavity, it can result in the galvanic shock and the peg. Bacteria from the caries. So all these things can be result in the irreversible pulpitis. So what are the clinical features? Clinical features is the tooth is sensitive to thermal changes, especially cold. Pain, short duration, disappear on withdrawal of the irritation. So once the irritation is removed, the pain is subside. The affected tooth responds to stimulation of electrical pulp tester at a low level of current indicated low pain threshold, and teeth usually show deeper caries, metallic restoration with a defective margin. So these are the main clinical features of the main clinical features of the reversible pulpitis. That means reversible means it will come back to the normal pulp state once the irritation is removed. So it is clinical features that is sensitive to thermal changes, especially cold, short duration pain. Once stimulus is removed, the pain is subside. The affected tooth responds to stimulus of electrical pulp tester at low level of current, and there's tooth shows deep caries, metallic restoration with the defective margins. Now comes to histological. Histological features are dilation of the pulp blood vessels, edema fluid collection due to the damage to the blood vessels and allowing extravasation of the RBC or diapedesis of the WBC, slowing of the blood vessel, slowing of the blood flow, chemioconcentration due to the transduction can cause thrombosis, a respiratory or reactant dentin in adjacent to the dentinal wall. So these are the histological features of reversible pulpitis. Okay, now dilated blood vessels and inflammatory cell infiltrate. Okay, now what are the diagnoses? Diagnosis based on symptom, clinical test, cold test. What is the treatment? Prevention of the dental caries. That is restoration of the dental caries. Then comes desensitization of the neck of the tooth with the gingival recession is that give a desensitizing fluoride application, cavity varnish or the base application, following before insertion of the filling, and care in cavity preparation and polishing. And if the primary cause is not corrected, extended pulpitis may result in the death of the pulp. So these are the the irreversible pulpitis where the irritating factors removed, the pulp is come back to the normalcy. If it is not removed, it will reverse. It will result in a irreversible pulpitis. So normally the hyperemic pulp in the early stage, the pulp, if the restoration is done, the hyperemic pulp can be, or reversible pulpitis can be bring back to the normal state. Okay. Now comes the acute pulpitis. The acute pulpitis is extensive acute inflammation of the dental pulp. Dental pulp is a frequent immediate sequelae of focal reversible pulpitis. Etiology: the bacterial inversion through the bacterial inversion through the dental caries most common, and chemical, thermal or mechanical cause. Reversible pulpitis may deteriorate into irreversible pulpitis. Okay, so it is if not proper treatment is not given for the reversible pulpitis, may result in a reversible pulpitis. Okay, or the acute pulpitis. So acute pulpitis, or otherwise known as irreversible pulpitis, it is an extensive acute inflammation of the dental pulp. It's a frequent immediate sequel of the focal reversible pulpitis. Okay, now the bacterial inversion through the dental caries, chemical or the thermal or the mechanical causes. Reversible pulpitis may deteriorate into irreversible pulpitis. What are the clinical features? Early stage involves only a portion of the pulp, usually the area just beneath the caries lesion. Or early stage, only portion of the pulp is involved. But the teeth sensitive to cold and cut causes increase in intensity persist even after the thermostabilization. So one of the main identification or the diagnostic method of irreversible pulpitis is that once the stimuli is removed, uh, the pain is not subside. The pain linger even after the removal of the stimuli, and the patient will have pain during the night. The pain poorly, and second is the pain is poorly localized. The patient cannot able to localize the pain from which tooth the pain is coming from, and intrapulpal pressure may cause severe pain or throbbing type pain, and pain intensity increases when the patient lies down. So these are the main clinical features of irreversible pulpitis. That is, patient is sensitive to hot and cold, may cause increase in pain intensity or persistent even after the. So one of the main diagnostic features of the irreversible pulpitis is that the patient will have pain even after the stimulus is removed. The pain lasts for 2 to 3 minutes even after the stimulus is removed. And the second is patient cannot able to locate from which tooth the pain comes from. And the patient will have pain because of the intrapulpal abscess formation. This pain may be severe pain, lacerating thrombic pain. It will last for 10 to 15 minutes, and intensity of the pain increases when the patient lies down. Okay, because the blood supply to the brain is, and there is a change in the atmospheric temperature. All these factors will cause the pain. Now comes the pulpal vitality, indicate the increased sensitivity to sensitivity at low level of the current, and pulpal pain is due to pressure built up due to the lack of exudate escape, and pain producing substance from the inflammation. The pulpal pain is due to pressure built up for the exudate cannot escape, and pain produces substance from the inflammation. The pain subsides when the drainage is established or when the root canal is started. And the pulp undergo complete necrosis. Tooth is not tender on percussion unless the pulpal inflammation has spread beyond the root apex into a periapical area, beyond the root apex into the periapical area. So these are the main clinical features. The main one is the patient will have one is the even after stimulus removed, the patient will have lingering type of pain even after stimulus removed. Second, patient cannot able to localize the pain from which tooth the pain is, and during the patient the pain will be last for 10 to 15 minutes once it is started. Second, the patient will have pain in the night because of night or lying down, because the blood supply to the brain is to the head is increased during lying down position. So all these factors will result in the pulpal irreversible pulpitis. So rise in the pulpal pressure along with the inflammatory exudate. So as the pulpal pressure increases, it compresses the venous, which will result in a decrease in the circulation, which result in hypoxia and anoxia and a pulpal abscess. These are the cause for the pulpal necrosis in case of irreversible pulpitis. Then comes the histological factors. Edema in pulp with the vasodilation, inflammatory of the polymorphonuclear leukocyte aligned with the vascular channels and migrate through the endothelium lined structure, destruction of the endoblast at the pulp dentin border. Abscess consists of pus, leukocyte, and bacteria, and acute suppurative pulpitis. Numerous abscess formation causes pulp liquefaction and necrosis. Okay, so these are the dental pulp exhibiting acute inflammatory consisting of predominantly polymorphonuclear leukocytes. Okay, now comes the diagnosis: is disclosure of deep cavities and pulp exposure. Radiograph exposure to the exposure of the pulp carries under a filling thermal test. So the treatment is drainage of the exudate from the pulp chamber, pulpotomy, and placing the calcium hydroxide over the entrance of the root canal treatment, and or extraction of the tooth. Okay, this also main treatment is either root canal treatment or the extraction of the tooth. Okay, so in young tooth and all, we can give pulpotomy. This is to help formation of the root completion or apexification. Okay. Now comes the chronic pulpitis. Any infection that lasts more than 3 months can be considered as a chronic infection. The persistent inflammatory reaction in the pulp with little or non-constitutional symptoms. Clinical features: pain is not prominent. Mild, dull-like, which is intermittent. Reaction to thermal changes is reduced because of the degeneration of the nerve. Response to the pulp vitality tester is reduced. Wide open caries lesion with the exposure of the pulp causing relatively little pain. Manipulation with a small instrument often elicitate bleeding but with a little pain. So these are the clinical features. Chronic pulpitis. Chronic pulpitis is mainly persistent inflammatory reaction in the pulp with a little or non-constitutional symptom. There is no symptom. So what is the main feature is that the patient doesn't have any symptom. Okay, so usually the sometimes a mild to dull ache which is intermittent. The reaction thermal changes is reduced, and because of the degeneration of the nerves, response to the pulp vitality tester is reduced. Wide open caries lesion with exposure of the pulp causing relatively little pain, and manipulation with a small instrument elicitate bleeding but little pain or no pain. So chronic pulpitis is usually asymptomatic. Okay. So what are the histological features? Infiltration of the mononuclear cells, lymphocyte, plasma cells, and with vigorous connective tissue reaction. Capillaries are prominent, fibroblastic iniquity and collagen fibers are bundled, and granular tissue formation occur in wide open exposed pulpal surface, ulcerative pulpitis. If the pulpal reaction vacillate between an acute and chronic phase, causes pulp abscess formation, which is surrounded by fibrous connective tissue wall, which is called pyogenic membrane. So these are the clinical features. So dental pulp exhibits an area of fibrosis and chronic inflammatory inflammation peripheral to the zone of abscess formation. Okay, the treatment is root canal therapy and extraction of the tooth. Okay, now comes the chronic hypoplastic pulpitis. So overgrowth of the pulp tissue outside the boundaries of the pulp chamber as a protruding mass that is characterized by development of granulation tissue covered at times with epithelium and resulting from long-standing low-grade irritation. Etiology, that is slow progressive caries exposure of the pulp, a large open cavity, a young resistant pulp, and a chronic low-grade stimulation are necessary. What are the clinical features? Actually, that is a pulp polyp is usually occur in the children and young adults with a high degree of tissue resistance and reactivity and response to proliferative lesion. Teeth with a teeth with a large and open caries lesion. That is, pulp is pinkish red globules of tissue protruding from chamber and extending beyond the caries. Most commonly affected are deciduous molar and first permanent molar, and pulp is relatively insensitive. So these are the clinical features of pulp polyp. It usually occur in children and young adults with a high degree of tissue resistance and reactivity and response to proliferative lesion. Teeth with large or open caries lesion. Pinkish red globules of tissue protruding from the chamber and extending beyond the caries. Most commonly affects are deciduous molar and first permanent molar. A pulp is relatively insensitive because nerves are not there. Only this lesion bleeds profusely. It contains only blood vessel. There is no nerves. Due to the excellent blood supply, high tissue resistance and reactivity in young person leading to the unusual proliferation of the proliferative property of the pulp. Some cases, gingival tissue adjacent may proliferate into the caries lesion and superficially resembles hyperplastic pulpitis. So careful examination is made to determine whether the connection is with the pulp or gingiva. Okay, so clinically you should be very careful whether the pulp polyp is from the gingiva or from the pulp. Okay, so this is the diagram of the pulp polyp. Now comes the histological features. So hypoplastic tissue is basically granular tissue, consists of delicate connective tissue fibers and the young blood capillaries. The inflammatory infiltrates, that's lymphocyte, plasma cells, and polymorphonuclear leukocytes, fibroblast and endothelial cell proliferation prominent, stratified squamous type epithelial lining resembles oral mucosa with a well-formed retipex. Grafted epithelial cells are believed to be discriminated epithelial cells carried by saliva. Origin of these cells is unknown. They are generated superficially squamous, which have lost dividing capacity. Now, diagnosis seen in the young patients, young children and young adults. Fresh red pulp mass fills most of the pulp chamber or the cavity or even extend beyond the confines of the tooth. A large open cavity with the direct access to the pulp chamber. Treatment is extraction or the extraction of the tooth or the pulp extubation. So now comes the gangrenous pulp necrosis. That is necrosis of the pulp. Untreated pulpitis result complete necrosis of the pulp. As this is associated with the bacterial infection, pulp gangrene, it is associated with the foul odor when the pulp is opened for an endodontic treatment. In a sickle cell anemia, blockage of the blood vessel seen, dry gangrene, the pulp dies of unexplained reason. This may be due to trauma or infarct. So these are the difference between irreversible pulpitis and reversible pulpitis. The reversible pulpitis is the nature of the pulp pain is mild or moderate, sharp, severe, radiating pain, long duration, and may intensify. Brief duration can be produced to cold stimulus that elicit the pain mostly. Although hot, sweet, or sour food may also initiate the pain. The pain continues even after the stimulus is removed. Once the stimulus is removed, the pain is subside. The pain may exacerbate with bending over or lying down. The tooth responds to electric pulp tester at a low current, increased by the stimulus like heat at a time, relieved by cold through the cold may intensify the pain. Reversible pulpitis, it allows it to progress, can lead to reversible pulpitis when infection extends into the periodontal ligament, causes periodontitis. the diseases of the pulp is over. Thank you.